Good evening and welcome. I'm Helen Thornton, AFSCME Council 31 Regional Director in the Greater Chicago Metro area. We've come together tonight to learn more about one of the most critical issues of our time, putting an end to the coronavirus pandemic that has caused so much sickness and death in our state, in our country, and around the globe. The most important weapon in this battle is the COVID-19 vaccination program. And that's what we'll be focusing on because we know it's something that many union members have questions about. AFSCME, both the national union and all affiliates, strongly encourage all the employees we represent to be vaccinated against COVID. But ultimately, the decision is your own. Our intent tonight is to help you sort through all the reports and rumors so you can make an informed choice. We have over 700 members who've signed up for this program tonight. So I have to tell you in advance that we will likely not be able to get all of your questions. However, the good news is that we've discovered from the questions that were submitted in advance that many of you have the same concerns. So we are going to try to focus on those issues first. After we've heard from tonight's presenters, we will be going right back to some of the questions that were sent in. If you didn't get a chance to send your questions in, you can still ask it tonight by just clicking on Q&A at the bottom of your screen and typing in your question. If we don't get to all of the questions, we'll be sending out follow-up material to provide that information. One of the things I want to remind you of, we have AFSCME members from all across the state attending this virtual meeting. Those who work for state government, for cities, for counties, for school districts, and more. That means that we won't be able to get into employer-specific policies, such as getting COVID time off or which job classification should get priority for the access to the vaccine. These issues vary from employer to employer. Instead, we're going to be talking more generally about the vaccines as they affect every one of us. But I do want to emphasize that AFSCME is continuing to press employers of every type with regard to adequate personal protection equipment, fairer time off policies, and expand access to the vaccine. Your local union or your Council 31 staff representative can update you on the status of these efforts. Now, let me introduce you to the two presenters tonight. Martha Merrill is the Council 31 Director of Research and Employee Benefits. In addition, she serves as the union's COVID response coordinator and has been deeply involved in our union's efforts to address the broad spectrum of workplace issues that this pandemic has given rise to. Carla Gillespie is Council 31's Regional Director in Central and Western Illinois. She is a registered nurse with more than 2 decades of experience in a variety of healthcare settings and with a specialization in the vaccination programs. Carla, let's begin with you.
So good evening. As Helen said, I'm a registered nurse that just happens to work for AFSCME. And so when I went to work for public health several years ago, it was shortly after 9/11, and the focus at that time was in the country was bioterrorism, and we were planning for mass vaccination clinics. We did that for years, and so I am really excited to talk to you about how vaccines work in general. That's what I did for the bulk of my time in public health. We're finding that we're getting a lot of questions about just how the COVID vaccine works with a lot of our members. There's a lot of concerns about how the vaccine works, especially during this pandemic. So so when a person is first exposed to the virus that causes COVID, it can take several days and even weeks before your body uses all their germ fighting tools that they need to get over the infection, if you're lucky enough to get over the infection, as we all well know. So after a person gets infected with the virus, a person's immune system remembers what it learned on how to protect the body from the disease. And it creates what we call memory cells. That's not the scientific term, but that's how it's easy to remember. And so it can quickly go into action if the body comes in contact with this virus again. So experts are still trying to figure out how long these memory cells can protect a person against COVID-19. So the COVID-19 vaccine helps us develop the same immunity without us actually having to get sick. It's the same principle as actually being sick with the virus without having to get sick. As we all know, contracting the illness has come at a huge cost, with hundreds of thousands of people dying or being in the hospital for a long time. And we've also seen lingering illnesses and an array of baffling symptoms that include fatigue, depression, headaches, respiratory issues, and who knows how long these symptoms last. We've had lots of data showing that people have had these symptoms and still have these symptoms after having, an illness where they didn't get hospitalized. So vaccines are important because it's one of the many steps that you can take to protect yourselves and your loved ones. And it can save lives. It could be your life or the people you love or the people you take care of in the settings that you work in. So stopping a pandemic requires using the tools we have available. And the vaccine is one of the biggest tools we have available to us right now. So the goal is to reach herd immunity. And I know a lot of us have heard the term herd immunity. But herd immunity is simply when so many Americans have protection from the vaccine, either by the natural infection or by the vaccine. And that's when the virus struggles to spread and eventually dies out. So public health officials, including Dr. Fauci, who's our leading infectious disease doctor in this country, and they estimate that it would take 70 to 85% of the 330 million Americans to be exposed to either the natural infection or the vaccine to reach herd immunity. So we've got a lot of work to do, right? So we want to reach that herd immunity. And remember, past infection can create some immunity, but it's not clear how long that natural infection can give us that immunity. And there's some evidence that points that it's not lasting very long. We just don't know. So vaccines are our best and safest way to get there. And there is some data that suggests that vaccines are giving us better immunity than the natural infection. So there's two vaccines right now that we have, Moderna and Pfizer. Those are the two that have emergency use authorization, and Martha's going to talk about what that means here in a little bit. But the efficacy that those two vaccines, the Moderna and Pfizer vaccines that we currently have available to us right now in this country, have a 94% efficacy rate, meaning that there's a 94% protection rate from these two vaccines. That's pretty good coverage, 94% protection from these two vaccines. There's also some terms out there, and these questions came to us, so I'm trying to cover in layman's terms, because there's some pretty intimidating terms out there, and there's a lot of confusing information. We've discussed kind of how vaccines work in general. Vaccines, try to give you what natural immunity would do if you had actually come in contact with the virus. So there's several COVID-19 vaccines out there that have been developed, and there's, I think, somewhere around 11 different vaccines being used worldwide or being developed. We have two. We have two in the United States that they're using currently. That could change tomorrow. That could change a month from now. But until they're approved, we have two. And the information is overwhelming. So we want to be clear, about what we know today. So you may have heard the term messenger RNA. And so that is the mechanism that the two vaccines we have right now, Moderna and Pfizer, is the mechanism that these vaccines work with. So to trigger an immune response against an infectious disease, many vaccines put a weakened or an inactivated germ into our bodies. So these two vaccines do not do that. They're messenger RNA vaccines, which is a pretty scientific term. all that means is that they, the messenger RNA vaccines, instead of putting an inactivated or weakened form of the germ, the COVID germ, into our bodies, it's just a different mechanism. It's a protein or a piece of a protein that teach our cells how to trigger an immune response without putting a weakened or an inactivated form of the germ into our bodies. And so then this protein or piece of a protein teaches our body to produce antibodies to protect us from getting sick if we become in contact with the COVID virus. Researchers have been studying this messenger RNA for decades. And so interest has grown in this type of technology because it can be developed in laboratories using readily available materials. So it can happen faster and quicker. So that's all it means. So don't be intimidated by those terms. So I just wanted to kind of give you a simple explanation of how messenger RNA vaccines are produced. And so the Pfizer and Moderna vaccines that are available to us today are messenger RNA vaccines. So I'm gonna turn it over to Martha now to explain how some of the processes worked in getting those vaccines developed quicker. Martha?
Sure, thanks, Carla. So I think a lot of us learned a new term in December when the vaccines were put forward to the FDA, and that's this emergency use authorization. So I'm going to focus on for a little bit, what was the approval process for these vaccines and how do we know that they're safe? So an emergency use authorization is provided by the FDA in emergency situations when there is not an adequate medical product for a specified condition. In this case, there is not a vaccine for the COVID pandemic that we're facing. An emergency use authorization allows the vaccine to be distributed at a faster time frame than the traditional full FDA approval process. But just because the authorization has been expedited doesn't mean that the vaccines are not safe or that they have not rigorously been evaluated. The designs that the manufacturers put in place to test their vaccines were the gold standard. And there was very careful scientific design and rigor in the trials that gave the scientists at the FDA and medical professionals who have reviewed the information confidence in these vaccines. And in many respects, the process for an emergency use authorization is very similar to the process of applying for a full approval through the FDA. These two vaccines, the Moderna vaccine and the Pfizer vaccine, went through a 3-phase trial, which is the same as any vaccine that has been put forth to the FDA for approval. So they've gone through the same scientific process, and during those trials, no serious harm was discovered. So the FDA determined that the benefits of the vaccine were shown to outweigh any potential risks with the vaccine and the potential risks of contracting COVID. And as Carla said, the FDA is globally respected for its scientific standards when it comes to evaluating the safety of drugs that we take, of vaccines. And so we know that in its evaluation of these vaccines, it was a very thorough process because that is what the FDA does. It thoroughly evaluates drugs to make sure that they're safe. But one of the things that the FDA did when they were establishing the emergency authorization criteria for the COVID vaccines, one of the things they did is they committed to a transparency threshold. And so they've made the materials that they've reviewed to determine the safety and the efficacy of the vaccines available to the public to see. And so there's been multiple peer reviews of outside entities who have reviewed exactly what the FDA did and have published those reviews in medical journals. States have engaged with their experts to review the materials that were submitted by the manufacturers and the results of the trials as well. And everyone so far has agreed with the FDA in terms of these vaccines being safe. So the emergency use authorization, it's been used before in various times. It was developed after 9/11. And again, it's a mechanism to deliver a vaccine or other medical product in cases of emergency, but it doesn't mean that corners were cut. And it doesn't mean that it didn't go through the same scientific review for safety and efficacy as other drugs that are put in front of the FDA for approval. Another question that we get, or that I've heard, and I myself had the same concern, was how do we know that these vaccines were safe? Because they were developed so quickly. And I think during the summer and in the fall, a lot of the discussion about the timetable of the vaccines seemed to be politically driven. And that raised some concerns. But in my role as the COVID coordinator, I had the opportunity to listen to the experts at the FDA and the CDC who were part of the approval process. And there's a real kind of reasonable explanation as to how these vaccines were being able to be developed so quickly. You know, part of it is because we're in an unprecedented situation with this global pandemic. And because of that, there has been worldwide cooperation with regard to coming up with vaccines to help fight against the spread of COVID. And that compressed timeline in terms of the development of the vaccines reflects this partnership between the drug manufacturers, the government, the academia, and the other thing that really pushed the vaccine was the amount of funding and attention that was put forward in this fight against COVID. And as Carla said, this messenger RNA vaccine has been 20 years in the making. And so there has been kind of a process that has got us to this point where this vaccine was able to be developed in such a short timeline. But rest assured, no corners were cut in determining the safety of these vaccines. Some of the things that were done that were able to compress the timeline, besides the partnership, were that some of the trials were run at the same time, allowing them to shorten the time frame. But at the same time, still a gold standard in terms of the trials. They use this double-blind placebo, so people didn't know what vaccine they were getting. The doctors didn't know what vaccine people were getting or if they were getting the placebo. So they still followed all the rigors of a trial. They just did it in a compressed manner. And the other thing is a lot of the red tape was cut. You know, they were able to go to the front of the line. They got advantages that in other instances aren't available when drugs are being manufactured. So by the end of the trials, people felt comfortable with regard to knowing that these drugs were safe and effective. And I think that even though these drugs were approved with an emergency use authorization, they continue to be monitored for their safety and effectiveness. So I think with that, I'll give it back to Carla, and she can talk about what you can expect when you're getting the vaccine.
So a lot of the questions I get, and a lot of what people seem to want to talk about is, will I get sick with vaccines? What do I expect with vaccines? And so, again, I've given thousands of vaccines. I have not given COVID vaccine, but with the vaccines, both the vaccines that we've talked about, the Moderna and the Pfizer, they're given in the arm. They're given in the muscle in the arm, the deltoid muscle, and they are both 2 doses. The Moderna vaccine is given to folks ages 18 and above, and they're it's a 2-dose vaccine. The Moderna vaccine is given the first dose, and then you have to wait 28 days to get the second dose. The Pfizer vaccine is given to ages 16 and over. Neither one of these vaccines have been tested in children. So, and that one is a 21-day interval. So that means you can't get them any sooner than the 21-day or the 28-day. If you had a interval of more than the 21 or the 28 days, it's okay if it's longer than that. You want to try and stay within those intervals, but if the vaccine were not available or you couldn't get back for till the 30th day or, the 60th day. You would not have to restart the cycle. So that's important, because it may not be available or you may have a reason you couldn't get back. You want to try and stick to those intervals, but you would not have to restart the series. But you have to wait at least the minimum amount of days to get the second one. So that's important. The second dose is important too. You need to get the booster to get the maximum efficacy from the vaccine. So you want to, we've had some questions about, can we wait till other vaccines are approved? Should we wait and see what kind of efficacy comes out with newer vaccines? So, the problem with that is we don't know how soon other vaccines will be approved. We don't know if other vaccines will be approved. We know that there's news of new strains coming. In my humble opinion, in my experience with infectious diseases, when I did work in public health and with vaccines, if you have a vaccine available to you, we want to go back to normal life. We want to get out of this pandemic. If you have a vaccine available, get the vaccine that's available to you at the time. That's my humble opinion. So a lot of people want, talk about the immune response, the side effects from the vaccine. So most post-vaccination symptoms are mild to moderate and occur within the first 3 days after you get the vaccine. Okay, so it happens 1 to 3 days after you get the vaccine. The symptoms are more frequent and more severe following the second vaccine, with the disclaimer that if you have had COVID, you should still be vaccinated. And sometimes people that have had COVID will see more severe or frequent symptoms if they've had COVID after their first vaccination, because their body's already been exposed to the virus. So some of the more common symptoms are pain or swelling at the injection site, which is similar to the flu vaccine. You're going to have a little pain, unless, of course, I gave you your vaccine. I'm really good at giving shots. But or maybe some swelling in the lymph nodes in the arm that you were given the vaccine in. And then some people, would get maybe some fatigue or headache, chills, muscle pain, joint pain, nausea, vomiting, fever, within 12 to 24 hours after getting your vaccine. But again, those symptoms are usually mild. They usually subside within 3 days after the vaccine. And really, mild symptoms like that are a good sign that your immune system is responding appropriately to the vaccine. It's a good sign that your body is responding. They're getting those memory cells to learn how to fight should your body come in contact with the real thing and can fight the virus. And I would rather feel crummy for a couple of days post-vaccination than end up on a ventilator when I come in contact with the real thing. I mean, for me, and again, I've had, a lot of experience with infectious diseases and vaccines, but to me, it's a simple choice. It's a choice, you have to weigh the options, the risks and the benefits, but it's clearly, there's a lot of good data out there. So contraindications in getting the vaccine. The only people that absolutely should not get the vaccination are those people that have had a severe allergic reaction, what we refer to as anaphylaxis, to the first dose of the vaccination, or those people that have had a severe allergic reaction to a component of the vaccination. And those are some big words. You can, if you want to know what those words are that I'm not going to try to pronounce on this webinar this evening, but they're not unlike the components of any other vaccination that's out there. So if you've had a severe allergic reaction to a component of any other vaccine, you should definitely look into this and see and look up the components of this vaccination. Those are rare. Those are rare that people would have a severe allergic reaction to the components of this vaccination, but you should check. If you are pregnant or have an underlying condition that compromises your immune system, you should not assume that you should not get this vaccine, but you should contact your physician and discuss it with your trusted healthcare provider and discuss whether or not you should get this vaccine. But if you are pregnant or you have an underlying health condition that compromises your immune system, you are also at greater risk from getting very sick from COVID. So you should discuss it with your doctor. You should not assume that you shouldn't get the vaccine. You should talk to your healthcare provider on whether or not you should get the vaccine. So people are worried about whether or not you could get an allergic reaction to the vaccine. There have been, on rare occasion during the trials and during, you know, people getting the vaccine, that there have very rarely someone having an allergic reaction to the vaccine. So you should, you know, people are there, anybody that's giving the vaccine are screening for people that are at risk for getting an anaphylactic and a severe allergic reaction to the vaccine. They should have, they will have tools to treat you, like epinephrine on hand, if they would have to treat you for an anaphylactic reaction. And it's rare. So it's not unlike any other vaccine or any other medication that anybody has ever taken. If you pull out anything that, when you take a medication over the counter, prescription, or any other vaccine, there's a risk of having an allergic reaction to it. So COVID vaccination is not different than any other vaccine or any other medication that you would take any other time. So, so this is no different than that. The other thing that I want to mention during this section of the presentation is, should, you know, once I get my second vaccine, does that mean I'm free and clear? I never have to wear a mask again. I'm never at risk for COVID again. Once you're vaccinated with both doses, should you choose to go that route, and I hope that after, you know, we give you good information that might be the way you lean. It would take 10 days to 2 weeks to get good solid protection from the vaccine. Your body needs that time to build those memory cells to get a good immune response from this vaccine. And remember, the vaccine efficacy from these two vaccines that we know of tonight is about 94%. And again, it's going to take a while before the country gets that herd immunity. We got a long way to go. So we should all continue to maintain the social distancing. We should all continue good hand washing. We should wear masks. We should do everything we can to educate our family and our friends and our coworkers. And we should do everything we can to get good, solid information from trusted sources, because a lot of the misinformation is because we're not getting the information from trusted sources. There's a lot of misinformation out there and a lot of wrong information. So we want to make sure we're getting our information from the CDC and from trusted sources. So make sure you're getting good information, and when you do get your good information from trusted sources, we're sharing good, trusted information and not from the rumor mill. Okay, Martha, I'm going to turn it back over to you.
Sure. So I think just to piggyback on one of the points you raised about, you know, should I get the vaccine? Is it safe for me? Just to remember that between the two vaccines, the trials contained about 70,000 participants who volunteered to be injected with the vaccine. And the trials involved people of different ages, sex, race, ethnicity, weight, you know, underlying medical conditions. And to Carla's point, the only contraindicators, the only people who have been determined who it's not safe, or that further conversation needs to be happen, are those with a specified reaction to the first dose or to the components of the vaccine. So I think, again, remembering what the science is with regard to these vaccines is important, and the rigors and steps that went through in the evaluation process. And so to that point, you know, Carla talked about this, the immediate kind of immune response, or folks say side effects of getting the vaccine. There's a lot of questions that are about what are the long-lasting side effects, or how do we know, you know, given that these vaccines were created so quickly, what do we know about them in the long term? And as I had mentioned, the side effects and safety were rigorously monitored during the trials, and they continue to be monitored through the distribution, because these manufacturers are still applying for the full approval through the FDA. So these drugs are continuing to be monitored as they're being distributed to try to identify any kind of adverse reactions to them. But what we know from over 100 years of vaccine science is that if there's going to be a major adverse reaction or event to happen as a consequence of getting the vaccine, it's going to happen in the first 6 weeks. And as part of the studies, these vaccines the participants were monitored. The FDA required that the participants be monitored for 2 months. So there's data on over 9 weeks monitoring these participants in the trial and their reaction to the vaccine, and there were no adverse events. So what we know based off of the science of vaccines makes scientists feel very confident as to the safety of these, the Moderna and the Pfizer vaccines. And I think the other thing to keep in mind that I thought was really interesting and that I don't think a lot of folks talk about is that the trials for the Moderna and the Pfizer vaccines started last year. The human trials for Moderna started in March. So folks were getting injected with the vaccine in March, and the Pfizer trials started shortly thereafter in May. And so they've been tracking these participants in these trials for almost a year. And again, they have not seen any of those adverse reactions that would make the FDA concerned about having these vaccines be authorized for use. So do we know with absolute certainty that 5 years from now, something might be discovered? No, but you also have to weigh that with what we know about COVID right now. And as Carla mentioned, there are so many instances of folks who have lingering medical impact because of the COVID disease that's affecting, is affecting their health. And so, you have to weigh what we know about COVID versus what we know about the vaccine. And I think we don't know exactly the long-term impact of COVID on the heart, lungs, and brain and the damage that it's causing in our bodies. But I think over this year, we've seen the experience of the vaccine and the experience of having COVID. And so far, the vaccine seems like a much better option in terms of protecting yourself than, ending up with COVID. And so I think, the other question is if I choose to get the vaccine, how long will I be protected? And again, that's something that we don't know yet. When the scientists discovered after that 9 weeks that these vaccines were safe and they were effective, they went ahead and applied for the emergency use authorization. They didn't track the vaccine for a year because people are dying, and this pandemic has overtaken our lives. It has caused so much damage, and so we don't know kind of the long-term efficacy. It was kind of one of, I guess, if you could say there was a corner cut. They didn't wait a year before, delivering it. They wanted to get the vaccine out, and because it was safe and because it was effective, to have it be out there and offer that protection to people. But that's something that they're continuing to study. But might we need a booster in a year? We might. But what we know is that right now it can offer us the protection that's needed in order to turn the corner on the pandemic. So before I turn it back to Helen to answer some of the questions that have popped up and questions that have been submitted beforehand, I think I just wanted to give a little bit of an overview or perspective as to where we are in this country right now with the vaccine. Monday was a milestone in that more people have received the vaccine than been diagnosed with COVID in our country. 33.9 million people as of this morning have been received a dose of this of either the Pfizer or the Moderna vaccine. And so you can kind of compare that to, right now, I believe there's about 26 million people who've contracted COVID. So if you're on that wait and see fence, I mean, at this point, we've got almost 34 million people who've received the COVID vaccine. And so far, putting aside, a handful or two of people who've had an anaphylactic reaction, so far, all indications are that the vaccine is safe and effective and can protect us against some of the really devastating consequences of contracting COVID, which include death. I think as of this morning, about 445,000 people have died of COVID-19, and it's predicted that by the end of the month, we're going to reach the threshold of having over 500,000 people having died over the last year due to COVID, and that is about 1 death a minute. So again, you know, these vaccines have been rigorously evaluated through the FDA, through outside scientists, and they really do offer us an opportunity to turn the corner on this pandemic. Because at this point, things are still really out of control in this country with regard to the number of COVID cases. I mean, we've seen a little bit of a decline from the holiday spike in terms of COVID cases per day, but we're still so much higher than we were in terms of COVID cases per day than we were in the fall or in the summer or in the spring. And so there's urgency to trying to do everything we can to contain the COVID pandemic in this country, particularly since we are now hearing really some alarming concern over these new strains of COVID that are showing up in the United States. And so there is urgency in instituting a really comprehensive vaccination program and as many mitigation measures as possible to turn the corner on COVID. So I think with that, Helen, we'll turn it back to you so we can start with some questions.
Great. Thank you, Carla and Martha, for those very informative presentations. Now I want to turn to some of the questions that members submitted earlier this week. The first question is a two-part question. A member asked, how can I go about convincing my elderly parent to get the shot, or should she?
Well, Helen, absolutely. And elderly, I mean, anybody over 65, obviously, even without any underlying conditions, is in a high-risk category. So absolutely, you know, an elderly parent should get the vaccine with or without underlying conditions. And I think that the best way to convince anyone in that category would be to give them the data, you know, that they're at higher risk from developing COVID and from getting very sick from COVID and potentially dying. That, you know, the folks over 65 and with underlying conditions are dying and getting very sick from COVID, not having good outcomes from COVID. And I think then if that doesn't convince a parent or somebody in those categories to get the vaccine, and also talking about the safety and everything we talked about this evening, maybe enlisting the help of a trusted healthcare provider to just, you know, going with them to their healthcare provider to discuss the importance of getting the vaccine. That's what I would recommend with anybody's loved ones that are still on the fence.
Thank you, Carla. That was very helpful. So the next question is, many African Americans I know are afraid to get the vaccine because of the way healthcare systems have treated us in the past. What can be done about that?
Helen, we are finding that we are seeing a disparity in the African American community as well as the Hispanic community as far as vaccine compliance altogether, and this is not new. You know, the legacy of racism in the medical field is real. It's real. And we, you know, but so is the impact of COVID in the communities of color. It's a huge concern. So there are disproportionate rates of COVID-19 illness and death in Black communities, due in part to the legacy of racial health disparities that exist in this country. And so according to the COVID racial data tracker, African Americans who contract COVID have died at a rate of 1.6 times greater than white individuals. That's alarming, right? So these safe and rigorously tested vaccines that we've talked about all night, I mean, you know, we've given you the data, and the data's from trusted sources. You know, that they're available now, and it offers the opportunity to help stop the tragic deaths in the community. And so, you know, we really have to find a way to make sure that this data is out there and that the data is there from the trusted sources, and that we're sharing the data with folks in these communities so that they get these vaccines and save these lives.
Thank you, Carla. That was also very helpful. The next question is, I got the first shot, but then my girlfriend told me she heard about someone who died from the vaccine, and now I'm afraid to get the second shot. What should I do?
Well, again, this person got the first shot, and barring any severe allergic reaction from the first vaccine, so that person probably would not have any problems with the second vaccine, and I'm certain of that. But the other thing is there is absolutely no data linked to any deaths from the COVID vaccine. There have been, some studies showing that, there have been some people that have died from after getting a COVID vaccine, but not from the COVID vaccine. They've vaccinated people in nursing homes that had illnesses or that were in hospice. They were dying anyway. So that died shortly after, but it wasn't linked. There was no causation from the COVID vaccine. So people are skewing the data. There have absolutely been no cases of deaths related to the COVID vaccine. So it is, I would tell that person that they should absolutely get their second COVID vaccine.
Thank you, Carla. That's very good to hear. So the next question is a very common question, and it's, are employers going to start mandating that we get the COVID vaccine in order to keep our jobs?
I'll take that one. So at this point, the Illinois Department of Public Health, which is putting forward kind of the vaccine guidance for our state, has said that the vaccine should be voluntary. So that is what we know right now, that the guidance from the Illinois Department of Public Health is that the vaccine should be voluntary and not be mandated for workers. What we don't know is what will happen in the future, and that's what we can't speak to at this point. So could things change? Possibly, with regard to a mandate for the vaccine. That could come when these vaccines get the full approval from the FDA. It could come if the new strains of COVID potentially spike again, and we're at a level that is even more where the level of COVID in our communities is far greater than it is right now in terms of the community spread. As public employees, could the legislature do something? We don't know. We don't know what might happen in the future, but what we know right now is that the guidance is that these should be voluntary, and we continue to be part of those discussions with regard to the vaccine and workplace safety. And we'll continue to do so and continue to keep you apprised of that situation.
Thank you, Martha. That was very helpful information. So the next question, here's a member who's concerned because she heard that the HIV protein is used in the vaccine. Is that accurate?
I'll take this one too, because I was part of a webinar, just a webinar that I participated in, not that I was a panelist on, but I participated in a bit ago, where this question came up, and I hadn't heard of it, but there was this concern, and it actually is from an Australian vaccine that was in the trials. So this was not something that had been approved and was being was approved for wide use and was being used. This was a vaccine that was it was part of trials in Australia. And what was happening was when they were injecting people with the vaccine, their bodies were producing the HIV antibody. So what they weren't coming down with HIV, they weren't being infected with it, but somehow the vaccine was creating the immune response that Carla was talking about, where it was creating these antibodies, the HIV antibodies. And so right away, when they realized that was happening, they stopped the vaccine, they stopped the trials. Everyone was safe. There wasn't a safety issue, but it was really, they were concerned obviously about the confusion of going down a path of having a vaccine that was creating that HIV antibody in folks, and kind of the long-term confusion and chaos that would create. So, so yes, I am familiar with that. That was in Australia, a trial vaccine. That is not the Pfizer vaccine. That is not the Moderna vaccine. But I think that that's a really good question to kind of talk a little bit about the vaccine creation process that we're in right now. I was looking at, there's a vaccine tracker website. And right now, I thought this was interesting. There are 67 vaccines that are being, that are in clinical trials right now across the world. So there's 67 vaccines that are currently being tried. And there's an additional 89 vaccines that are in that preclinical phase. So they haven't quite yet been injected into arms, but they're getting to that place. And so I think what we have to keep in mind is not all these vaccines are going to work out, right? So there are going to be some duds in there. And just because there are, doesn't mean that the ones that have been approved aren't safe, right? So we just have to keep that in mind as we're reading and doing research, and rightly so. I think people are doing their due diligence and trying to make informed medical decisions. And just to keep that in mind, that there's vaccines that are in trial. And then, as Carla said, there are other vaccines that are being used in other countries that aren't being used in the United States. And there may be some other things going on in some other countries, but those are not the Pfizer and Moderna vaccines that have been approved by the FDA for use in the United States. And I think that kind of speaks to kind of that, the difficulty, as Carla said, of all the information that is out there. And when you go on the internet and you're trying to do your due diligence and trying to make an informed medical decision about taking the vaccine, like how much noise is out there about the vaccines. And just one thing to keep in mind is that when folks take the vaccine, if there's any adverse reactions or side effects that they want to report, they can do that through this VAERS system. It's the Vaccine Adverse Event Reporting System. And what we're seeing when you go on the internet and you Google, COVID vaccine bad reaction, you're seeing a lot of articles that are using the VAERS data to try to insinuate that these vaccines aren't safe, and trying to insinuate that there's some scientific verified negative reaction when the people who are writing these articles are using this information in a really misleading way. So this VAERS database is used by scientists. When someone reports something happening to them, the scientists flag them, and then they do further investigation. So it's not, and anyone can go on the VAERS database and report a negative reaction to the COVID vaccine. And there's scientists who've gone on and said, like, I've turned into Hulk, the Incredible Hulk, just to show that you can really type in whatever you want in this database. And then what happens is the scientists will go through it, they look for trends, they flag things, and they do further investigation. So if anyone is using data from VAERS to say this conclusively shows that the vaccine does X, Y, and Z, that is not how VAERS works, and that is a misuse of the data. And that's where I think some of the rumors and misinformation about the vaccine is coming from folks misusing the VAERS data, but then you're also just hearing, the vaccine has microchips, the vaccine will make me infertile. Those have all scientifically been shown to not be true. So it's really important to, again, just look for trusted resources, and also, multiple resources, right? If you see it one place, look for it in another place and make sure that this isn't just, an anti-vax article, and that this really is kind of a scientific examination of the vaccines. Because if you're going to do your due diligence and make an informed medical decision about taking the vaccine, you should do it based off that.
Wow, that was great. That was very, very helpful, Martha. A lot of good information. We're also trying to respond to some of the questions coming in via Zoom tonight as well. So Carla or Martha, can you tell us why it is so difficult to get an appointment to be vaccinated?
That is a good question. That is something that I know so many people are facing. I have been facing it, trying to get my parents, who are both 75, an appointment to get the vaccine, and causing a lot of anxiety. You know, right now there's just such a limited supply of vaccine in this country. And because of that, the Centers for the CDC, through an advisory committee, has put forth a prioritization with regard to, you know, given the limited supply, how should the vaccine be distributed? And what they've looked at is age, they've looked at underlying medical conditions, and then they've looked at, you know, what is the work that you do. And so they've divided and created these groups to which the vaccines will be offered. Group 1A was healthcare workers, residents, and staff who work at long-term care facilities. And so when the vaccine first became available in December, and then through the beginning of January, the healthcare workers and residents and staff who work in these congregate living, you know, nursing homes, long-term care facilities, they were prioritized. On January 25th, the state moved into the next phase, and widened the group that would be able to have the vaccine. That group included people who are over age 65, as well as individuals who are considered essential, kind of frontline, public-facing workers. And so again, these categories were established by this advisory committee, and there's a lot of contention about the 1B group and who should be included and who wasn't included, who should be included. And that is a fight that we're continuing now, you know, through the, conversations with employers, you know, asking and trying to work cooperatively to advocate and lobby the local health departments, making a case that these workers' jobs, because of what they do, they can't work remotely, they can't socially distance, that they should be included in the 1B category. And so there's a lot of contention over the 1B. And I think, unfortunately, there's a lot of differentiation between the availability and distribution of the vaccine across Illinois and across the country in terms of its availability, where you may have one local health department in one county who's doing something slightly different and making it slightly differently available than another county. And so there is a lot of confusion, a lot of frustration about getting the vaccine, a lot of it stemming from the fact that we don't have then enough needed. The category of 1A and 1B, I believe, encompasses about 4 million Illinoisans. That's a lot of people in these two categories, and there just isn't the vaccine. It's been a slow trickle. You know, there's been a big push on the Biden administration to, you know, increase open up the supplies and have, as you know, vaccines going into arms as quickly as possible. And so, you know, they made some announcements about more vaccine becoming available next week, and hopefully the situation will improve over the coming weeks. But a lot of access to the vaccine is being driven by the type of job that you do, if you are currently a worker, or your age. And so, you know, once we get through 1B, or we're through enough of the 1B workers, Then it will move to the 1C category, which are individuals under age 64 who have an underlying health condition, as well as other essential workers. And then once we get through that category, we'll move on to phase 2, and that's pretty much kind of the general public. So there is a prioritization and categorization in terms of your availability. But I think what we're finding is even if you are in that category where you are eligible for the vaccine, it's really hard to find. And I think there's a few things that are making it that not just the limited supply, but also the fact that the Moderna vaccine and the Pfizer vaccine have to be stored at cold temperatures. It has to do with the fact that these vaccines don't have preservatives in them. And so to keep the RNA safe and to keep the vaccine usable, they have to be stored at lower temperatures. So that just makes the distribution of it challenging and the ability to put the needles in arms more challenging. So it is a frustration, and the hope is that it will improve with time. So in general, if you're looking for the vaccine, they're saying that there's kind of 4 different avenues to get them, to get a vaccine. The first being through your healthcare provider. So if you are in a category now where you're eligible to have the vaccine, you should reach out to your healthcare provider and ask about whether they are inoculating people. Right now, you need an appointment. I think with no matter what avenue you choose, because there's such a limited supply, you need an appointment. There aren't any of those large-scale vaccine sites yet available where no appointments are needed. One day, I hope we get there, but we're just not there yet. So if you are in the 1A or 1B category, reach out to your doctor, healthcare provider, hospital system, see what they're doing in terms of providing vaccinations. A lot of employers are doing on-site vaccination clinics for their employees who fall under and are eligible to receive the vaccine. There are, some public sites opening up, or the federally qualified healthcare centers that are also distributing the vaccine. And then in pharmacies, so your CVS, your Walgreens, your grocery store pharmacy, Walmart, so forth, they will also be giving out the vaccine. So those are kind of the 4 main mechanisms to get the vaccine now if you qualify. We have a link on the AFSCME Council 31 website that will direct you to the governor's vaccine locator dashboard, where you can put in your zip code and it will let you know kind of where all your vaccines availability sites are, within a certain radius. So there are some tools that are out there to help people try to find a vaccine and make an appointment so that they can protect themselves. And there's no cost. The vaccine is free. There's no cost to getting it. That was part of the deal that the government made in backing the drug companies and allowing them to create the drugs so quickly. So one of the things that they did was they started manufacturing. The government agreed to pay for the manufacturing of the drugs before they were even proven safe, just so that if they were proven safe, they were ready to go. And so because the government has purchased all this vaccine, it is being distributed at no cost.
Well, that's great. All that information, again, is very helpful. The next question is, isn't the vaccine only approved by the FDA for emergency use? And what does that mean for us?
So I think, I talked about it, and I think that the emergency use is kind of a strange name in that, I don't think it really speaks to what the FDA has done in their process. So it kind of makes it seem like it was a hasty action taken. But as I said, it's a very rigorous process that the FDA established and then went through when it decided to approve these vaccines for use in the fight against COVID. And again, the emergency use name comes from this provision that allows the vaccine, or allows the FDA to kind of take a different approach when there is a emergency like a pandemic that's killing, you know, one person every minute at this point in the United States. It allows them a mechanism to get the vaccine through the evaluation process at a quicker rate than kind of a traditional approval process. But just because it has that emergency use does not mean it hasn't gone through a full, you know, full force evaluation that the FDA does anytime it's evaluating a drug or a medicine.
Well, thank you for clearing that up. So the next question is, what kind of side effects am I likely to experience after getting the second shot?
So again, like we talked about, you're likely to affect mild symptoms like fatigue, sometimes chills, fever, body aches, joint pain, maybe some pain at the site of the vaccine. And some people will experience those after their first vaccine, especially if they've already had COVID. But again, remember that that's just your body's immune system working correctly to learn how to defend itself against the actual COVID virus, you know, should come in contact with it. So, so those are the likely side effects that you might have with the COVID vaccine.
Okay, thanks, Carla.
Should subside within 1 to 3 days.
Thank you. The next question is, can I still spread the virus even if I've been vaccinated?
So that is one thing that we don't know yet from the trials of the Pfizer and Moderna vaccine. You know, they were very much focused on the safety of the vaccine and the efficacy in terms of how effective it is in preventing COVID. But there's still some unanswered questions. You know, we had the opportunity to participate in a town hall style conversation with Dr. Landon, who is a revered expert on infectious disease. And, you know, when this question was posed to her, she said that she thought it was very unlikely that someone could after being vaccinated, spread kind of asymptomatic COVID in the community. But we don't know. We don't know that yet. But that's a question that we're going to know soon. One thing that scientists learned rather quickly in the trials was because COVID was so widespread in the community, it was really easy to evaluate whether people were protected from the vaccine or not, just because of how COVID was spreading. And it became pretty apparent that people who had received the vaccine were not coming down with COVID at the same rate as, I mean, not the people who were in it because it was a blind study, but like the scientists, right? Like who were in the back, right? I mean, it was pretty apparent that the vaccines were effective. And so I think because we are in a situation where COVID is so rampant, those questions about, you know, being able to spread it will be answered. It won't be a question mark forever. We'll know the answer. But in the meantime, to what Carla said, they are, you know, recommending that even though you yourself are protected from COVID and the, you know, harmful consequences of contracting the virus, it's still important to do all those other mitigation, the mitigation like wearing a mask, socially distancing, following the recommendations based off of where you are in the state and the gatherings and so forth that they think are safe. So we continue to wait and learn as these vaccines continue to be monitored.
Great. So the next question is, do the vaccines now available protect us from the new strain of the virus?
Well, that's another question that we don't know everything yet. Scientists are really digging into this because there is significant concern about these new variants of the COVID virus that are showing up. Right now, I think they've identified kind of 3 that they have their eye on. There's the UK variant, there's the Brazil variant, and there is the South African variant. And as of, I think I was looking yesterday, I believe the only variant that has been discovered in Illinois is the UK variant. But at the same time, there could be variants in the United States. There could be a United States variant. We just don't know yet. But because this virus is rapidly spreading and continues to rapidly spread, that's part of what a virus does. It mutates and creates variants because it's spreading. So they looked at the Pfizer and Moderna vaccine, and scientists feel pretty comfortable that they are both effective effective in protecting you against the UK variant of COVID. With regard to the South African variant, it is effective, it's just not as effective. But they're continuing to look at that and figure out what that means, and tracking this virus variant and other variants, and whether that means that depending on how predominant it becomes, it could mean that we'll need a booster of another COVID booster, or the formula may have to be altered. But I know that these variants are creating a lot of concern amongst scientists. And I think that speaks to the importance of being vaccinated now with the vaccines that are available to us. Because if we can protect ourselves, if we can slow down the spread of COVID in our communities, then we can slow down the mutation and the potential of there being other variants created. Because if worst case scenario, COVID continues to spread unchecked, we could get variants where they'll have to start all over in creating new vaccines and so forth. At least the ones that we have now, even if they're not at that 94% efficacy, they are effective in the prevention of COVID, including these variants. And so at this point, with some of these variants that are highly contagious, I'll take my chances with some protection versus no protection at all.
Okay. Well, thank you. So we're going to wrap this up. And so there's one last question for tonight. And when will everybody have access to this vaccine?
Well, as Martha said, go ahead. I'm sorry, Martha.
Oh, I was going to say, I think that's the $1 million question. When will everyone have access to this vaccine? And I'll start, Carla, you can chime in. I think it's dependent on a lot of factors. There's a big push by the current Biden administration to prioritize COVID mitigation and the vaccination program. And so I would hope that with that attention that the Biden administration is putting on this real serious attention, that we will see more doses of vaccine being available in the communities, where we can move through phase 1C and move to phase 2. I think to just circle back on a point that Carla made and that I'd like to echo is that if you are given the opportunity to be vaccinated, especially, in your workplace where it's right there, you should definitely take advantage of that opportunity, because having to, secure an appointment outside of work through a pharmacy or through your doctor, it's proving to be a real challenge for people who aren't having that opportunity to have an on-site clinic. So, and the quicker that the 1B group gets vaccinated, the sooner that we can move on and do the 1C and the other groups. I think another factor that will contribute to how quickly the vaccine will become available will be the other vaccines that are coming down the pike. Right now we have 2 that are available. There's other vaccines that are currently in the phase 3 trials that, depending on how those go, will go in front of the FDA for review. And so if there are other vaccines that are approved, that could also speed up when the general community will have the ability to be vaccinated.
Great, thank you.
Carla, did you want to add something? No? Okay.
Thank you, Martha. So we've covered a lot of ground tonight, and I hope we've shed a lot of light for you on the matter of the COVID vaccinations. Again, as Martha mentioned earlier, you can find more information on the Council 31 website at www.askme31.org. This link includes a link to the governor's statewide vaccination location finder, where you can just put in your zip code to find out where vaccinations are available near you and for whom. Just as we've done every day over many decades, AFSCME is working to protect the health, the safety, and yes, the lives of every single member. That means safer conditions in the workplace, and it means the opportunity to be vaccinated as quickly as possible. Sisters and brothers, as with every challenge we're confronted, we're all in this fight together, and it's a fight we cannot afford to lose. So let's all move forward together in a healthier tomorrow. Good night and stay safe.